Hello, everyone, and welcome again to another episode of Driving the Business of Science. This is a podcast specifically meant to look at the business aspects of life science in general and what happens there. Let me talk a little bit about um, the person that we're going to be talking to today, my guest for today, Samantha Trotman Burman, who is going to talk about mental health across the life science spectrum. So that's going to be our topic for today. Before we get into that, and I'll let her give you her background and talk about that. Let me tell you a little bit about Court Square. Court Square is a managed service firm. We manage infrastructure for life science companies, pharmaceutical, biotech, med device. We start and manage qualified and validated applications all the way from preclinical through manufacturing. We've also created a system called RegDocs 365, which is a content repository that hosts and manages TMF, EDM reference model. We've got a thing called Life Science Launchpad to help startup companies go from startup all the way to where they can get sold to big pharma companies. So our goal is to help scientists and the life science sector really get to the next level without throwing a lot of money at trying to put all this stuff together and having qualified and validated background. With that being said, I got to meet a very interesting person last year. And I'd love to have Samantha Trotman Burman talk a little bit about herself and about StoryCatch Partners. So Samantha, if you wouldn't mind, come on in.
Absolutely. Thank you. I'm really happy to be here, Keith. Thank you for inviting me. So my name is Samantha, and I have been part of trying to figure out better solutions in the space of mental health over the last 12 years, actually, partly out of need myself, with individuals within my family and myself struggling with certain aspects of mental health during struggles in life. And it made me realize that while there's a lot of good work being done out in the mental health space, there is a lot of good programming and good content out there. There's not enough that is reaching the people that actually need it when they need it. And there's a lack of ability to translate in some ways from the some of the scientific discoveries or the research that has or is being done back into the utilizers of that work. And there's very little also being done to support what I call the stakeholders or the caregivers, so the people around our teenagers, young adults, and other people that are struggling. And so I was really drawn to that work and started by using a lived experience peer model where I help other people that are going through struggles. I help them with some empathy, some guidance, if you will, or like case management, as well as education. And there's also, I have a little interest in the idea of having education also be entertaining. So I call it edutainment. I think there's no reason why we can't enjoy while we're learning. So that led me to meet with a gentleman by the name of Jim Cavan, who has a long background in research, particularly around rare disease. And so combining together my learnings of the creating a community around shared struggle, as well as Jim's expertise with finding out about rare disease and poorly understood physical health, we came together and founded a company called StoryCatch with the idea that we can create a community where people get support now, but also invite them to be part of gathering information and data that can make for better health and better decisions in the future. And so that was when I was able to meet with you, Keith, and realize that the work that you had already done with building the company that was called EmpiraMed, that we could really um, take the platform and the work that you'd already done and start adding in some more features of a broader view of health, including mental health as well as physical health.
It's interesting because when I first met Sam, we were having lunch at Zapdig's out in the Boston area, which is we that's our normal place to go to meet now whenever we have to have a team meeting. Um, but one of the things that struck me the most was thinking about the company which had been in Pyramid at the time, which is now StoryCatch Insights. Um, we first started talking about a mental health registry and a women's health registry that we were working on. And the concept was that we were already knee deep in technology from a perspective of doing ePro, which is electronic patient reported outcomes. We were doing eCOA, all the things that you think about for clinical trials and things like that. But we were also working on some registry applications, and one of them was with the American Liver Foundation. So we had just started with them, and that's one that you guys have picked up since then and keep fostering that and keep driving it. What was interesting to me was looking at your drive and your passion around mental health issues. And realistically, I started to think about mental health issues and how they affected so many different therapeutic areas and what happens. And if you think about it, I had to go through recently. In December, I had a knee replaced, and I had another one replaced at the end of March. You start to think about just taking body parts out and replacing them with artificial limbs and things like that. And you already have, you start to think about that in your head. Well, the reality is that's nothing compared to people that are going through life-threatening stem cell treatments for cancer or things like that. We have a friend right now that's going through some of that, and we pray for them on a regular basis. But the reality is, what's going through his head right now as he thinks about his future and where things are going to be at. And this happens with people all over the place. And I've seen, patient advocates that talk about lifelong struggles with rare disease and different things like that. And they're in such a different place than most people are day in and day out. We take our health for granted so much. When you start to think about what they must go through, not only on the health side of it, but on the mental health side, it hit home to me, the work that you were thinking about and how our technology and your thoughts can actually coexist together, and how bringing Jim on board. And I've known Jim for years as well from past companies that we worked with. And at some point I'll have Jim on because I think he's got a great background, and I'll have him talk with some of the tools he did. But I think let's talk a little bit more about where you see things going and how you see that intersection of multiple technologies and bringing things together.
Yeah, no, absolutely. And, I like the example of the physical examples, because I think oftentimes one of the problems that we have with mental health and collection of data around mental health is that there's not really a good common set of vocabulary. And those are things that we're going to have to look to develop. But the example that you gave with the knee replacement, my husband had heart surgery about a year and a half ago, and he came through it physically very well. But the impact, even though we had been told that it would have an impact on his quality of life and the way that he thought about life for about a year after the surgery, that was never really tracked in any sort of systemic way. So he went to cardiac rehab, and people would say, well, how are you feeling? And he would say, good. And that was it. And so there was no information gathered or really anything structured about how he was really feeling with respect to anxiety, with respect to his feelings about the surgery, and the fact that he felt like he had almost died, the fact that he was on bypass for a long period of time. And the doctors would talk about things like pump head and little terms that they had for that phenomenon. But really wasn't, it really wasn't, we were not educated in the way that could affect him and then affect the stakeholders or the family members. And so bringing it back to, one of the things that I think is a great moment in time that we have is that a platform like EmpiraMed that is already doing the highest quality data collection, we already understand that there's a lot of information outside the electronic medical record that affects the way that we feel both physically and mentally. And I think our ability to get closer and closer to that real world data, so closer and closer to the identified patient, but also with the use of survey work and other features, we're able to also get feedback from the secondary observers or the family members. And that's going to paint a much richer set of data, both in terms of depth and breadth, where we're going to be able to really get at some of the drivers of that sense of whole person health, or your overall well-being, your mental and physical health, and the way that they interplay. And I think that's going to mean that there's much better information and ultimately better programming and ways to intervene when somebody's not feeling well, whether that is physically or mentally.
Well, I think you hit on a couple of really great points, because a lot of times it's the caregivers that they're the only ones that can actually answer some of those questions about how those people are doing. And because they see the new normal, when you think about Alzheimer's patients, things like that, they're not going to be able to answer things, right? It's going to be the caregivers that are going to be able to do that. But they also have their own mental health issues that they have to deal with, because when they're seeing a loved one, going downhill over the course of that progression of that disease, that's got to be a huge toll on them as well. And you got to start thinking about all the ancillary effects of different disease states and how they all work. One of the other things we talked about was the concept that we could have patient registries in multiple therapeutic areas. But what happens if somebody has comorbidities and they have multiple diseases? Now it affects one thing, it affects another. We were talking a little bit earlier about the Women's Health Registry and just how many different diseases do women have. In this country, you start thinking about most of the big pharma companies, the biotechs, and they're run by men. So most of the men don't think about the women's issues that we have. So having something out there where some of the researchers can talk about what's going on with women's health and how we can kind of tie that together this year and in general, prior to this current administration, there was a big push toward women's health and putting together a whole consortium around women's health. So hopefully that's going to be front and center and keep driving that. Talk a little bit more just about your drive with the aspect of different areas like women's health and how they kind of tie together with some of the other things that you've been thinking about in the long run.
Yeah, absolutely. The women's health project that we are launching will be an excellent example of how we're looking at health in that broader sense and looking at the overlap between physical and mental health and understanding some of the signals and the patterns that can be collected when you're looking as broadly as you possibly can. And some of the best studies in history, the heart study and the longitudinal study that was done out of Harvard, they didn't know what they were looking for. So they were collecting as much as possible to get as rich a set of data as possible. And I think that that's going to be really important in the Women's Health Project because we are looking at the ways in which, the phenomenon of being female impacts those different struggles throughout life. One example I've been hearing anecdotally, and StoryCatch is a name on purpose because I feel like the stories that I hear and that I tell throughout time evoke emotion, they get people interested because that's that human connection piece. And the stories can allow you to sort of form a community around that. But we really need to capture some key elements of those stories and in order to really be able to bring about the systemic change. So that's why the stories are so important to me because they are sort of part of those signals. But the story I've been hearing lately is about women who have had first psychosis events during perimenopause. And nobody's studying that. And so the hormonal changes that happen in women during menopause, are thought to cause a lot of symptoms, but there's really not been any study where it says, okay, let's look at what that really means for the overall physical and mental health of that person who may or may not be a caregiver to others. And we do know that there's a strong correlation between primary caregiver mental health and those of the children in the family. And so this is not to blame moms because I'm not a mom blamer, but I do know that the stressors that both take a toll physically and mentally on women as they are caring for others has a big impact on those people as well. And so I think that while there's been some great research done in certain areas, the way that we're trying to both look very broadly, but then also be quite specific in certain areas is going to be very novel.
Very, very good. I was thinking as you were talking, I was thinking about some of the movies you watch and things like that, and you see how the parents will a lot of times spend so much time on the child that has a disease that they almost neglect the other child that's there, and then you start to think about that, and you wonder about those interactions between different things. So that was just something that a thought that came in my head as you were talking. But then the other thing that I was thinking about when we talk about technology and bringing things together from that perspective, as we're getting more smarter tools around the house, whether it's your Alexa in the house that you can talk to, whether it's things wearables that you're having, there's a lot of things now that are actually giving us way more capabilities to look at that real world data, because the real world data, for most people, you mentioned EMR records. Most people think about, hey, listen, the doctors are going to ask you for stuff and you're going to be able to tell the doctor. But the funny part is most people, when they get in the doctor's office, oh, I'm fine, or this is good. They forget all those things that happened in between doctor visits, and part of the issue is when you're experience it, during that time when you experience something, if you can capture that thought or capture that idea, that's the perfect time to do it. Then you start to see correlation between the data and things like that. We now have AI tools that can actually start looking at lots of data across a large data set to be able to identify things and identify trends or things that may not be there. I know one company I was working with, they had they had the ability to look at smaller data sets and actually identify patient cohorts that stuck out in trials that some people may have missed. And I think that that's where this industry is going. And I think companies like StoryCatch that have the ability to not only capture the medical data that you normally catch, but also the other data around that, and then toss that and tie that back together with environmental data and everything else that's there. Who knows what really is affecting what's going on? And you mentioned that longitudinal study where they just captured everything. I'm a firm believer in more data is better. And I think the more data that we can collect, particularly around anything that you're dealing with, the better. So from that perspective, I think that you're right on the right track and you're doing stuff. Tell me, you also have a couple things that we talked about in the past about, bringing in music theory and bringing in musicians and things like that. Tell me a little bit about your thought process there.
Well, and I really like the way you depicted, the gathering of everything. And one of the things that I'm always thinking about from the having been a parent of kids that are struggling, I'm always very cognizant of the time that it takes to, manage everything, the time that it takes to track things. I think that there are technologies available now where we can make that much easier for people. If I want to be able to upload information into an app or a website, I should be able to upload that in different formats that make it convenient for me. So if that's a picture of my child when they can't get out of bed in the morning, or if that's a video, or if it's a self-reported, dictate to text, whatever way it is that makes it easier for me to collect that information, we should be able to, with the technology available to us now, make that translatable into coherent data sets. And the interesting thing too about our the ripple effect amongst the family members and how that works. You alluded to that as well, and our ability to be able to start to bring them into the study. One of my favorite comments about one of the longitudinal studies that we just mentioned in Harvard was that they even put down what the drapes were, or the color of the drapes, because they didn't know whether that had an impact or not. And one of the things that I feel like is really missing from a lot of poorly understood physical areas as well as mental health areas is what am I looking for? How do I understand what is already known about it? And then how do we go from there? How do we go forward?
Fantastic. When we talk about the business of science, I think that some people don't realize there's a certain type of company out there called a B Corp. Can you talk a little bit about StoryCatch and why you made it a B Corp?
Yeah, thank you. Thanks for asking that. So it's a public benefit corporation, and that is a company that is it is in its articles of incorporation. The company has not one purpose, but two purposes. So if you are a director on a public benefit corporation board, you have to balance the social impact purpose, which is in StoryCatch's right now in its documents, it says the global betterment of mental health. And then the second, but equally important, is a profitable model. And so it operates from a business perspective like a C Corp, but that the balancing act of the social impact with the profitability is one that I had been speaking about for a number of years, that I wanted to set up a business that, whether you called it double impact or double bottom line, was one where investors were seeking a way in which they could have that impact as well as a modest return on their investment. And when I met one of our colleagues, Ted Granite from McCarter English, he said, "Well, that's a B Corp. That's a public benefit corporation," and I had never heard of that before. So it's interesting. I think the biggest public benefit corporation that I know that's well known is Parker Warby, is the eyeglass company. And there are very few in the that I have found, if any, in the mental health space, and there are very few, if any, that I've found in the research space. And so what that means to me is that again, we're doing something, we're taking some best practices from different worlds, and we're putting them together in a way that I think will change the way we look at research and the building of community and the gathering of data to make for better health.
Fantastic. I heard about a B Corp before StoryCatch because I've been involved with a company called Posit, which does our studio, which is a data management technology. They give away their thing is they give away a free version to researchers, but then corporations have to pay for it. So that's how they fund the development of the tools that they can give away, which is great. So I love the fact that you guys are working toward that public benefit of mental health in the industry and things like that. And I know we've talked about a few things in the long run where we hope to see StoryCatch go and what can happen with that, particularly. And that was one of the things that drove me toward saying, yeah, let's merge EmpiraMed in with StoryCatch, because I think as a technology, we're a great technology. But when you think about the bigger picture and when you've been in this industry long enough, as I have, you start to say, what can I do to give back? And I think that there's lots of very wealthy individuals who, like you said, they want to invest, but they also want to see some social good come out of that. And I think that this is a great way to be able to do that. I applaud your efforts. I think that, once we get everything off the ground and it really kind of takes off, I think that you're going to see some tremendous benefit from that. I think the patients will actually see some tremendous benefit. And I think that's what we're really hoping for, is that as we grow and add more functionality with different companies coming on board, maybe different investors looking at what's going on, I think that it's really going to drive what your message is going to be and what you want to do. And hopefully we can extend beyond the couple areas that we started with and get yourself to even bigger areas where we can start gathering mental health across a whole spectrum of therapeutic areas. Because imagine if that could happen. Imagine if we could have a registry that's put together that looks across all therapeutic areas, and maybe it finds some correlation between mental health and weight gain or this, that, or that. Who knows? I don't know what it could be, but I think that's the kind of questions you have to ask in order to solve any kind of problem. So just being there and being able to do that. As we get on toward the end of our session together, do you have any words of wisdom or parting thoughts that you want people to think about when they think about StoryCatch, think about you, think about what your mission is going to be?
Well, thank you for that. I think what I'm hoping that we will be seen as from the external view is a community, and a community that really deeply cares and understands family whole person health. And that's a phrase that I think requires a little bit of explanation now, but my hope is in the future it won't, because people will have understood the work that StoryCatch has done and will benefit from it. And when I get asked, and you've been in meetings with me where we've been asked, what would be social impact for you? Profitability is pretty easy to measure. You know what that means. But in my mind, it's the number of people across the world that regularly access StoryCatch's community for support, education, and in participating in a better tomorrow.
Fantastic. That's awesome. Great to hear that. When I first met you, you said that there was a mantra that you kind of held to. Can you not talk about that?
Is the let's go
No,
version?
not that one. Not that one. I'm not going to go there. It's the other one, the one that you talked about, the living the life and what you wanted to do with your life.
Yeah, so my mission, if you will, is to not die ordinary. And
Very
so
good.
what I am hoping for. That's what I'm striving for. So at the age of 57, having started, two businesses in the last few years, I didn't expect to be doing this, but I always thought through all of the different jobs that I had in different industries, I always wasn't quite sure what I wanted to be when I grew up, and now I know it's this, which I feel very fortunate to be able to love what I do. And
Well, I think
so,
that anybody that meets you or has met with you will realize that you're anything but ordinary. So that's fantastic. So,
thank you. Appreciate it.
Samantha, thank you very much for your time. This has been, to everybody, this has been the Driving the Business of Science podcast. We had our guest today, Samantha Trotman Burman. Thank you very much for your insight, and let's see where you go, and maybe we'll have another one in the future.
Thank you. Be happy to come back and talk. Thank you. Appreciate it.
Thank you, Samantha. Thank you, everybody. Have a great day.